So arthritis is basically one of the commonest symptoms or diseases we see in the OPD, and the hallmark symptom of arthritis is pain. Arthritis is of different kinds and the symptoms usually vary with the kind of arthritis. Younger patients sometimes come with inflammatory arthritis, like what we commonly know as rheumatoid arthritis, or sometimes there may be arthritis like uric acid related arthritis. In older patients, we see arthritis related to wear and tear, which is commonly called osteoarthritis, and this usually happens when the joint is worn out from decades of usage. And the treatment basically depends upon first identifying the cause of the arthritis and then addressing it. So while inflammatory arthritis are treated very well with medication, the arthritis that basically are because of wear and tear or degenerative arthritis as we call it are often treated with physiotherapy and a different kind of modalities. Sometimes some of them being very bad are often require surgery also to treat them. So intra-articular injections are usually used as a second or a third line of treatment. The initial treatment for most arthritis is medical, non-invasive, which means we are not poking the patient or doing anything invasive to him. Sometimes some of these patients do not respond to medical therapy, and then we have to resort to more invasive treatment like joint injection. These are somewhere in between medical and final surgical therapy, and they often help either buy time before the definitive treatment or they help in symptomatic relief. Injections can be of different types. There are injections which are so-called lubricants, which can be given for wear and tear or degenerative arthritis. Sometimes in inflammatory arthritis, where there is a lot of inflammation locally in the joint, we can give injections which contain small doses of steroids, which have the advantage of not affecting the entire body, but having a high concentration in the joint. So they work very well in these kind of arthritis. There are also some biological injections like stem cells or platelet-rich plasma. You can imagine a tire on the car. With time, with overuse, the tire gradually wears out, and at a certain point of time, it's very difficult to run the car effectively without retreading the tire or replacing it. So the joint replacement aims to do the same thing. It is technically resurfacing the joint so that it is no longer painful. This is kept as a last modality of treatment. We start with non-surgical treatment as much as possible, from medication to physiotherapy to exercises, then move on to lesser invasive modalities like joint injections, and finally when all of these options have been exhausted but the patient continues to have symptoms which are affecting the patient's day-to-day living, or which are affecting what we call the quality of life of the patient. For example, a patient who thinks twice before getting up from bed and going to the toilet, or somebody who is not able to go out to the temple to pray, or even getting in and out of the car is very painful, and you've exhausted all your options, non-operative options. In that case, we offer surgery to these patients, and the large majority of them get back to normal day-to-day life very quickly, within about 2 to 3 months, and they are very happy because the efficacy of this surgery and the longevity of this surgery is a few decades. So for most of at the age that we do these surgeries, most patients this lasts lifelong, and it's a very positive modifier of their lifestyle. Very often joint pains can happen because of misalignment, and some of these alignment, if they are not fixed, if they are correctable, then these can be corrected and maintained by using a good brace. Although not all the arthritis can be treated like this, there are a certain subset of patients which can be selected, and if properly managed with braces, they can actually go through years without requiring surgery just with the management of braces.